The Mississippi Link is an African-American female-owned newspaper with a trusted voice that is highly respected throughout the city, state, and nation. Our motto, Keepers of the Knowledge for People Who Speak the Truth, since 1993. Link significantly influences the thoughts, attitudes, and buying decisions of its readers. Call us at 601-368-8481 for your advertising needs. If you would like to receive a newspaper in the mail each week, our annual subscription is only $52 per year. That is only $1 per week for you to stay informed regarding many stories that you can only get in the Mississippi Link. Sign up today at themississippilink.com and click on Home Delivery.
Good afternoon. My name is Dennis Ayers, and today we're going to start a new podcast called Health and Habit. Health and Habit podcast. We're going to is kind of key in on healthcare and healthcare topics. Today, this is our first one. I just want to talk a little bit about myself and introduce myself to the audience. I am a native Californian. And I've been here in Mississippi for a little bit over 31 years now. Now, one thing that we have to that I have to take a look at is I have been in healthcare for a little bit over 40 years. And one of the things that we see in Mississippi is a disparity in healthcare, which directly affects the outcomes and changes the narrative of quality health care. So we're going to talk about that a little today. We're going to talk about some numbers, and future podcasts we're going to invite healthcare professionals here just so we can kind of understand. We want you to understand the value of healthcare. With this podcast, we're going to talk about individual medical health care. We're going to have talks on Medicare and the open enrollment periods and the different special election periods in Medicare, because we know that people are receiving phone calls, unsolicited phone calls from telemarketers and brokers that are trying to get them to enroll in different plans throughout this nation. And we just simply have to make most people aware of this and the pitfalls that are associated with this. So we'll talk a little bit about that. We'll also talk about the benefits of going to a dentist on a regular basis and getting your annual wellness checkups from your doctors, but also going twice a year and getting your annual cleanings. There's value in all these things we're going to talk about. So we're going to start out our show today. And I received been reading an interesting article about America's healthcare ranking by the United Health Foundation. And we are going to, it's amazing compared to the nation where Mississippi is compared to their health care and them caring for their citizens. Health insurance is critical because when you have health insurance, you're able to receive preventative services and medical health care as you need it, which is very important because that will help you maintain good health. The issue with not having health care is not going to a doctor or going to a provider at least once a year to get your exam and find out if there's anything wrong. But I tell people this, and listen, this is the easiest way for someone to even just kind of suspect that they may need to see a doctor on a regular basis. Don't look any farther than your immediate family. If you have a history of high blood pressure, a history of diabetes, and so on and so on. Those are some of the things that you should look at to determine on if you need to seek medical care, or at least establish a relationship with a health care provider once a year to go and get that annual wellness. It's a big deal. If you have, if you're a part of the ACA or what they call the Obamacare, if you have group insurance through your job, or some other private health care company that's what they call credible insurance, included in that as of 2010 or the Affordable Care Act, Health Care Reform Act, then there should be a component in there that would allow you to see a doctor for your annual wellness at zero cost to you. And once the ACA did come about, we did see a significant drop in the uninsured, and we've seen an increase in outcomes in certain areas of the country. But yet nearly 79, almost 30%, or 30 million Americans still are uninsured. So, and the analysis found that 73% of uninsured adults did not see a doctor simply because they did not have health care. We live in a country where health care is not very cheap. It's for most Americans, they'll have it through their job, but if you have to come out of pocket as an individual, that health care may be a little costly. For example, the state of Mississippi did not, and I repeat it, did not extend the Medicaid, so it did not accept the federal dollars to expand the Medicaid for the ACA, or what they call the Obamacare. So here in the state of Mississippi, right now we have somewhere right around a little bit north of 300,000 people that are uninsured. So, here also we are fighting a constant battle of quality health care, and our outcomes reflect that. Our health care outcomes do reflect the fact that we did not extend Medicaid. So we want you to give us a call. We want to hear your thoughts. We'll be here for the next 30 minutes. You can call us at 1-800-492-5186. That's 1-800-492-5186. Let's talk about this and find out what we can do, or find out what you're doing if you do not have health care, to make sure that you are going to the doctor, how it's being covered if you're going to a federally funded clinic. But there are different ways that you can get this done. So give us a call. Once again, that's 800-492-5186. We also can be seen at We Believe Digital, Roku TV, Facebook, and also YouTube. So check us out, hit the like button, subscribe, and that way you'll get any updates on the program. So let's talk about health outcomes, the worst health outcomes. Okay. We will, okay, come on. All right. Okay, the uninsured in Mississippi. Right now, here in the state of Mississippi, the percentage or population not covered by private or public health care here in the Mississippi. There's right at 18% of all Mississippians is not covered or do not have health care. So when you look at a population of a little bit north of 3 million people, 18% is a significant number. So, and we have to figure out a way because right now there's we understand that there are more than one underserved area here in the state of Mississippi, where the average income is right at about $25,000 a year. The average income is right at about $25,000 a year. And so what we have is we have a large segment of our population that is considered what they call the working poor. They may be that single parent that may be working, making $9, $10, $11, maybe $12 an hour. The average household will have about 2 children of that single household. The kids may be covered if they're under the age of 18, and they may be covered by either CHIPS or Medicaid if that parent does not have a group health plan from their employer. So what we have is that mom or that dad gets sick and cannot go to work, then that household is facing, there's a whole nother issue that's coming up in that household, and that's paying the bills because generally these are the type of jobs that have either no or very little sick time, no or very little vacation time, and they may or may not be a 40-hour-a-week job. Most of them are somewhere right around 30 to 35 hours a week. So that puts a parent in an pretty tough dilemma. That per capita income, that puts Mississippi right at 50th. So the average income will rank us right dead last, or at the top of the list of the most impoverished state per household. So that's something that we should look at. Poverty, 18.9% of households in this state are impoverished, which places us right at 49th. Unemployment here in the state of Mississippi right now is right at about 6.8%. The national average is it went up a little bit, but it's still not that high. The national average is somewhere right around 3.84%. Last I checked. But we also have other issues here in the state, food insecurity. We have in the city of Jackson, and that's where this broadcast is being recorded today. We have a number of food deserts here in the city. The city of Jackson does not their public transportation is not up to par compared to some of the other cities of its size. So what that means to people in those communities where there is that food desert, they may have to travel 3 to 4 miles to get food. If they can't, public transportation doesn't take them there. If they can't get a family member or they don't have a car to get those groceries, then they may be in trouble because in a lot of cases they simply can't afford to pay cab fare to go get groceries. And those are some of the things we're facing. These are pretty dismal numbers here in the state, which I love and live in, but yet, violent crime is increasing. The city of Jackson, per capita, is the number one murder city in the nation. So, we have quite a bit on our plate. But the city of Jackson is not unique in this, in that if we look, this is just a snapshot of what's going on throughout our nation as a whole. So what do we do? How can we turn this thing around? Well, we know we're praying, but outside of that, what can we do? What can we convey to those who lead us? Do they fully understand what we're going through? Do they hear us when we talk? So give us a call, 800-492-5186. That's 800-492-5186. And remember to hit that subscribe button and that like button. And this is our very first show, so we want to make sure that we hit all the points here. And we're going to talk about some more things. Certainly, they're associated with uninsured, being uninsured, and we want to talk about. We're going to talk about premature death. We're going to talk about, just different things because this is important. We're going to talk about the unemployment, and we're going to talk about preventable hospitalizations. Because if you're uninsured, the chances of you going to a local urgent care clinic or finding a doctor to go to while uninsured is very small. But the probability of you going to the emergency room for something minor is extremely high. So, and that in itself will drive up health care costs. So we have to do something a little different. So let's hear your thoughts. Let's collectively, we do have the answer. Individually, no one by himself will have the answer for this. So what we'll do is we're going to talk about some of the states that or the areas that may produce some of the worst health outcomes, the premature and the cancer mortality, which is a huge issue here in the state of Mississippi. But first, we're going to take a break, and we'll be right back.
Do you have something to say? Do you want your voice heard? Join the We Believe Global lineup. Be the star of your own show. For more info, call 800-492-5186, option number 1, or visit online at webelieve.global.
The Mississippi Link is an African American female-owned newspaper with a trusted voice that is highly respected throughout the city, state, and nation. Our motto, keepers of the knowledge for people who speak the truth, since 1993. Link significantly influences the thoughts, attitudes, and buying decisions of its readers. Call us at 601-368-8481 for your advertising needs. If you would like to receive a newspaper in the mail each week, our annual subscription is only $52 per year. That is only $1 per week for you to stay informed regarding many stories that you can only get in the Mississippi Link. Sign up today at themississippilink.com and click on Home Delivery.
Okay. Well, we're back after that short break. Remember, we're talking about the cost of uninsured health care. And we're going into this segment, we're going to talk about some other things such as premature deaths. But you can reach us if you want to join in on this conversation. You can join in. You can call us at 1-800-492-5186. That's 800-492-5186. 6. Let's hear your thoughts on this, because what we want to do is we need to bring this to the forefront. If we're going to change things, then we have to be involved. I'm just one voice, but together we are many, and we can change things, and it can happen. You can also see us on We Believe Digital, Roku TV. Check us out on Facebook and YouTube. We have a powerful platform here. So we want you to hit that like button and subscribe. Subscribe to We Believe Digital. Now what we're going to do is we're going to dive into this thing, because one of the issues of the uninsured is the premature death rate. And, that premature death is a measure of years of potential life lost due to the death occurring before the age of 75. Death at a younger age contribute to what they call premature death. We who have health insurance, most of us do not hesitate to go to the doctor. Most of us do not hesitate to take our medication when we should, because that is the value of having quality health insurance. It promotes long life. It is a tool to promote long life. Of course, there are other things like not drinking or drinking and driving. Those things are no-brainers, and you shouldn't be doing those anyway. But if you expect to live a long, healthy life, exercise, making sure that you at least get yourself checked out at least once a year. If you have that issue of diabetes in the house where it's prevalent, please get yourself checked out. I don't care if you are 27 years old. If your grandmama got it and your uncle got it and they're on insulin, it may be something that you may want to take a real strong look at for yourself. At least go know your numbers. It's very important. We have the opportunity here in Mississippi to change things, and premature death here, years of potential life loss before 75, 75 per 100 population in a year's time. We have there's been right at a point to where we see a lot of premature deaths. A lot of it is not health care related. Here in Mississippi, we see we're in a rural state, so we do have a lot of tragic type of deaths. Certainly that does not play into this, but or it does play into this, and those are car accidents and suicides. But one thing we do have a higher rate of that's the murder rate, and a lot of that is stemmed from poverty. So we really have to take a look at a lot of these things, because all that poverty does affect our health care outcomes. So those are some of the things that we want to take a real hard look at on this show. So occupational fatalities here in our state is, we rank 47 out of 50. So our health, our workplace can be fatal if we aren't careful. We have to do better, and we can. There's nothing that's saying that we cannot do better. One thing that we as a state have to take a real hard look at, and that is the poverty rate here in the state. Like I said before, the average income for a single parent is somewhere right around $25,000 a year. The average household has, with a single parent, usually have about 2 kids. So you imagine trying to live for somewhere right around $25,000 a year, especially if your rent, if you're renting, will eat up probably about 50-60% of that, and that's not including food. So rates, food's going up, rent's going up, everything's going up, except your paycheck in most cases. And just keep in mind that, here in the state of Mississippi, we're not doing too bad. 67% we have 67% of home ownership, a little better than 67%. And that brings us down to about 19th in the nation. So we're doing some things right. Let's work towards doing a little bit better. Racial disparity is home ownership and racial disparity. So what you have is your people of color. They are right at 27%. We have to turn that around, and one of the reasons why African American home ownership has not risen is, for one, for credit, but for two, income. Can they afford to buy a house? Do they make enough money to generate a down payment on a house? So those are some of the things we have to look at. And what we're going to do is we're going to have a segment on protecting and building your credit. It's one thing it's a whole lot easier to protect a good credit rating opposed to building a good credit rating. But we'll talk about that another time. And all this leads back to our poverty component. Okay. So at income inadequacy, we're right at statewide, nationwide, we're right at 48. We're number 48 at inadequate income. So education, high school graduation, we've come up, and thank God for that. We're right at 29% right now. So we're right at 85% of high school graduation. So those have come up. And so those are some of the things we want to that are a lot that are getting better. Although here in the state of Mississippi, our voter, we as we talk about voting. Our voter rate or participation is right at 62%, but yet and still, the state of Mississippi has one of the highest rate of African American lawmakers in the nation, and but that's a two-edged sword. Although we have that percentage, we seem not to be very effective in creating the outcome. It's coming, it's changing, but we're not there yet. Once again, give us a call at 800-492-5186. That's 800 492 5186. And once again, we can be seen on We Believe Digital. That is our own platform. Roku TV, Facebook. Right now, you can see us on Facebook Live, or YouTube. And when you're on those platforms, hit that subscribe button and you'll get all the updates. But also, if you want to donate to this program or any other program at We Believe Digital, you can do that also from the format. So let's keep that in mind. We are going to continue to talk about these things because they do matter. We're here in the city of Jackson. We're going on, I guess, 2 weeks now without drinking water. So now what's happening now is the city of Jackson's passing out drinking water to its citizens. We need to figure this one out. Because what happens is we're having a breakdown of basic services. Utilities is a basic service, especially if you're paying for it. So we need to figure that out. I hope that our leaders will get the water situation straightened out. Because we have well over 150,000 people here in the city that depend on water. You can't drink it. You take a bath with it, but you can cook with it once you boil it. But this is an issue that we need to address as a community. Not only do the city, but also the state of Mississippi, along with the nation, we have a very difficult conversation we need to have with ourselves. So, but that's not necessarily a bad thing. We just need to muster up the guts and have it. Have the conversation on race. That's forefront. Have a conversation on infrastructure. That's another one. These are just some of the things. Have an education. Have a conversation on the education process. Right now, we see that there are some works to want to change history concerning what we did and how we lived our past. But that cannot be. In order for us to know who we are and not go back, we need to know where we came from. So these are some of the things that we need to talk about amongst ourselves. That may not be in a public format, but it is something that we as Mississippians have to. We have to take a look at this stuff, and we have to talk about it. Right now, we have, abortion is the hot topic in the state of Mississippi. But infant mortality for those that live, or a mother giving birth not surviving, it's one of the highest rate here in the state of in the state of Mississippi. It's one of the higher rates here in the country. So yeah, we can take a look at some things. But as Americans, we really, really, really have to start doing better. Not so much throughout the world, which is great, but amongst ourselves and amongst our own people. So my name is Dennis Ayers. Once again, this show is called Health and Habits, and we can be seen at Roku TV, We Believe Digital, Facebook, YouTube, and thank you very much, and God bless each and every one of you.